Good morning, everybody. Thank you guys so much for joining me. I see Raymond, Kevin, Leora, Aristoc, Hamza, Naveen, Marsha. Thank you guys. Hi from Texas. So I want to thank everybody for joining me this morning and from all over the world. I appreciate it. And let's talk about, what it's like to be a urologist. I got a question in the community tab about why I chose urology. And I really think that urology is of course, the best specialty in medicine, and I'm biased because that's what I do every day. But the reason being, we do a ton of diversity of cases. We do small cases in clinic, in the operating room. We do small and we do very large cases, and we can really change people's quality of life. And we deal with these really intimate problems with patients, and it's a privilege and an honor to do so. So I'm really, really grateful to be a urologist. I think that we are the most interesting subspecialty in medicine, have some great colleagues, and I enjoy their company so much. I see a question here about after a woman has a C-section, can she become pregnant? And that's absolutely true, but please see your obstetrician to make sure when it's safe to start having intercourse after having a C-section, because you want to wait a certain amount of time before you get pregnant again to allow the uterus to heal. What other questions can I answer for you guys today? It is a beautiful day here in Baltimore, very nice and warm. We have these things called the cicadas that are coming out in droves, and these insects that come out every 7 years, and they are all over. And this is my first time being around the cicadas, so we'll see how that goes. Okay, so someone has a question about Peyronie's disease. Peyronie's disease is where you have a curvature or a bend in the penis due to plaque formation. We don't know the exact reason that these plaques form. Sometimes it's from trauma, sometimes it's from putting injections in the penis or things like that, but sometimes we don't really know. It can also be genetic. There are conditions that are caused that create some make you more likely to form plaques in the penis. And so, yes, there is this time, about 6 months, where we call it the active phase, and the curve is still forming, the plaque is still forming. It can be somewhat painful. During this time, we typically recommend taking any sort of non-steroidal anti-inflammatory medications like ibuprofen or naproxen, or some of you may know these as Aleve or Motrin to help with pain during that time. There's also some studies that shock wave to the penis can actually help during this time, but I don't do that, so I can't speak too much more on that part of it. Once you've gone past the active phase, you can go to the stable phase or the chronic phase. And during that time, there are a number of different treatments that are available, and you can try certain injections into the plaque. There are 3 major different types of injections that are done into the plaque itself, and they usually are over a period of several weeks. You're getting repeat injections to improve that curvature. You can do extenders, which have recently been shown to be effective. The one that's been studied is called Restorex, and that can help over time. Using it twice a day for 30 minutes can help reduce the curvature. And then there are surgical options. I have a whole video on this, so make sure you check it out on my channel about Peyronie's disease and the treatment options. Okay. Oh, every 17 years, the cicadas come out. Yes, not 7 years. Could low testosterone be the cause of nocturia? So that's a really interesting question. So estrogen in women specifically after menopause goes down. And there are estrogen receptors in the vagina, in the urethra, and the base of the bladder. And so what happens is if your tissues become atrophic or thin because of the lack of estrogen, this can cause pain, discomfort with sex. And there's some data to suggest that, yes, it may help with urinary control, but that's not typically what it's used for. It's used for increasing the thickness of the vaginal canal and one second, guys. So it can increase the thickness of the vaginal canal and also help prevent recurrent bladder infections. Okay. For frequent urination, is it safe to take a bladder control vitamin? Likely it's not going to hurt you, but it may not help you. So urinary incontinence, there are no great vitamins or supplements that can help with urinary incontinence. And so in that case, there's really not, there's not much that helps. If you're having recurrent bladder infections, cranberry supplements with soluble proanthocyanidins, 36 milligrams, have been shown to be effective in preventing bladder infections. But at this time, there are no supplements that have been studied effectively to show any benefit in reducing incontinence. Okay. Does a hanging ball a worse sign? So typically your testicles, which are your balls, will hang, and some will hang lower than the other. Sometimes it will be uneven, and that's completely normal. That's not an abnormal thing. So premature ejaculation. This is something that occurs when you ejaculate before you or your partner are ready for ejaculation to happen. It is very, very common, although most people do not seek care for it. And the reason being is that, it's embarrassing and it's actually kind of difficult to treat. So there's a couple different options. One is sometimes antidepressant medications have been shown as off-label use to help prevent premature ejaculation. You can also get a prescription for what's called Emla cream, which is a numbing cream that you put on the penis about 20 minutes before sex. Or you can get delay sprays over the counter. And I can link one down below from Promescent. It's a delay spray that I know the company, and they make a nice one. Okay, is estriol over-the-counter safe for vaginal wall thickening? So in the United States, we don't have it over the counter, but vaginal estrogen or estradiol is extremely safe. There have been no reports of blood clots, breast cancer, or anything like that with the vaginal form of estrogen. It's very different than taking it as a pill. Using it vaginally gets very little absorption systemically, so it's extremely safe. Although when you buy it, it will have the same black box warnings as the medication that you take orally, because they didn't differentiate, but that doesn't mean that it applies to the vaginal form. Okay, so somebody was complaining of circumcision. So having a circumcision as an adolescent and now having reduced sensation and numbness during ejaculation. So I'm very sorry that you are going through that. Circumcision is a procedure that is done to remove the foreskin, and it can be done for a number of different reasons. Sometimes it's done at birth. Very often in the United States it is. And then sometimes when people are older, they get it done because of things like phimosis or foreskin that doesn't retract, to be able to have clean underneath the foreskin, or sometimes it's painful because the phimosis gets trapped when you're having intercourse. But there is a 20% chance that you will have a change in sensation after having a circumcision. It can take some time to get better. So you may see improvement if you have some changes in sensation over the first year, but unfortunately, there's nothing, if you are unfortunate to fall into that category of loss of sensation, there's not much to do to improve it. You can experiment with different sensations like vibration, pressure, cooling, heating sensations, and see if that helps at all. What is the treatment for urgency? So urinary urgency is the sensation that you have to go to the bathroom, rush to the bathroom, and you can't make it, and you really can't delay it. You have to go right away. So you run to the bathroom. And so the treatments for this are dependent on the cause. So sometimes we can find that there is a cause for your urgency. So it could be because in men, you have a prostate, which is large and blocking the passage of urine through the prostate. And sometimes it can be because you have a high tone pelvic floor. So the muscles of your pelvic floor are really tense and stimulating the bladder and making you go more often. Sometimes we can't really find a reason for it. So we just have to treat the symptom. In those cases, there's a number of different treatments available. I've gone through a lot of these in a number of videos, including avoiding bladder irritants, trying to avoid constipation, making sure sure that you don't hold your urine for too long, and that quitting smoking. So check out my videos on 5 ways to improve your overactive bladder and bladder irritants to learn more about that. If those don't work, there are medications, which I've talked about in another video. There are anticholinergic medications and beta-3 agonist medications, which work by reducing the squeeze of the bladder, and so you have less of a squeeze and less urgency. And then there are what we call third line therapies. And there are 3 third line therapies that are currently available, more coming soon on the market, which is kind of exciting. But we have a bladder pacemaker, which I've made a video about, where you put a tined lead that goes next to the nerve root that stimulates the bladder and restores normal nervous function to the bladder. It's about 80% effective. And it is an operative procedure, but you do get a test period before you decide to go ahead with the surgery or not. Another option is Botox injections in the bladder. This is also 80% effective. You come into the office, you have Botox injected into the bladder wall on average, about every 9 months. And that works by, again, relaxing the bladder squeeze so you don't squeeze as much. And lastly, there is PTNS, or peripheral tibial nerve stimulation, which is basically acupuncture that stimulates the nerve that goes to the bladder. And you come once a week for 12 weeks, and then once a month or every 3 weeks after that. Okay. So a varicocele, there's a question about a varicocele. So varicoceles are essentially a swelling of the veins in the scrotum. So you might feel this in your scrotum, which feels like a bag of worms or spaghetti. And that is called a varicocele. And are these dangerous? Well, the large majority of the time, they're not dangerous. They can cause some discomfort. So you might feel pressure or heaviness, which may mean that you may want to consider getting it treated. Or if you are young and you notice that your testicle, one side, is not growing as much as the other side, in that case, it would be a reason to get treated. Otherwise, it's not going to hurt you, so nothing to do about it. Oh, lastly, the other reason to get it treated is if you're having infertility. If you're trying to have a baby and you can't conceive, getting your varicocele treated can potentially help with fertility. Okay. I saw this question a couple times, how to increase the duration of coitus. So there are, one, I think there's a lot of misinformation about how long intercourse needs to last. On average, it lasts about 5 minutes from penetrative intercourse. And so if you're more than that, you are more than average. So kudos to you. And if you desire having a longer coitus, there are a couple things that people have tried. You can try doing Kegel exercises, which I've made a video about, which can help strengthen the pelvic floor. That typically actually just helps you have better orgasms, and it may help with increasing the duration of coitus, but the data is not 100%. And then also using delay sprays or things to kind of reduce the sensation so you can have a longer duration of intercourse can also help. Okay, so if you guys ask the same question over and over again, I can't see other questions, so please don't do that. I will not answer questions if you keep asking over and over again. Okay, so let's see. I'm going to go back a little bit. My Amazon store link is not working. I'll look into that. Thank you. Okay. Sorry, guys, these people who keep asking the same question over and over again, they literally have taken up all the questions. So I'm trying to find some better questions here to answer. Are deodorants good for the scrotum in male? So I'm working on a video about decusant powders. There is some data that links the use of talc with ovarian cancer in women. And so I don't think that using talc-based products is particularly safe at this time. So I would look for non-talc-based products that are made with cornstarch or other things. And so I'm actually looking at a couple of them. I'm having, some friends and my spouse try them out and to let me know how they like them. All right, what else here? So I see this question coming up a lot. Is a penile curvature safe? Is it dangerous? Is it safe during sex? So it's not going to hurt you. It's not a dangerous thing. You don't need to worry about having issues. But the issue that some people can arise is that one, they don't like the way it looks. And two, it may actually be difficult to have intercourse with the curvature. And if that's the case, see a urologist to talk about treatment options. The frequency of morning wood, that is, it can be every day. And that's a normal thing. That's a completely normal physiologic thing your body is doing to increase blood flow to the area. And there's nothing wrong with it. It's completely normal. Is emotional lackness a reason for erectile dysfunction? Absolutely. Erectile dysfunction or issues with erections is a multifactorial issue. It can be caused by a medical problem, like not having good blood flow or nerve function to the penis, but it can also be caused by psychological issues. So if you have performance anxiety, you may have difficulties getting an erection. And then the next time you try to perform, that anxiety can come back and you can get worried about not being able to perform and then have kind of compounding in a big circle, getting worse and worse over time. Epididymal cysts are cysts that are on the epididymis, which is a tube-like structure along the side of the testes. And this is typically benign, but if you're worried about it, you can get an ultrasound of the testes and have it reviewed by a urologist to make sure that there is nothing concerning about that. What is the difference between a urologist and a sexologist? Great question. So a urologist is a doctor and a surgeon who takes care of the genitourinary tract. So that can be the kidneys, the ureters, the tubes that drain the kidney, the bladder, and the genitals and the outlet. So we take care of a lot of different things, including kidney cancer, bladder cancer, kidney stones, prostate cancer, urinary incontinence, erectile dysfunction, low testosterone. I mean, the list goes on and on. We take care of a number of different problems, whereas sexologists are pretty much focused on sex and the interactions that are associated with sex. Some of them you can be a doctor and a sexologist. You can take a course to become a sexologist, I believe, but I don't know much more about sexologists more than that. Okay, so here's a question about sorry, everything's moving so fast. So intentional sperm retention versus masturbation. So, there's a lot of people out there claiming that semen retention is great, improves focus, improves your quality of life, blah, 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 blah. I think that I know that there is no data to support any of those claims. So the no FAP thing that people talk about, I think it really helps people because people, specifically people who are very addicted to masturbation or pornography, getting a break from that can really improve your quality of life. But if you're just masturbating like a normal amount, it's not affecting your quality of life, there's really no reason to do that. But if you want to, for whatever purpose, it's probably not going to harm you. Okay. Are delay sprays any good? So, I think if you are suffering from something like premature ejaculation, it certainly can improve your quality of life because you can have delay the amount of time to having intercourse, to having ejaculation. Of course, it does reduce sensitivity of the penis. So you have to kind of play around and see if they are of benefit to you. Can bacterial prostatitis not taken care of properly be dangerous? Absolutely. So if you don't get treated for bacterial prostatitis, meaning you have an infection of the prostate, and typically that presents with pain with urination, a fever, lower abdominal or pelvic pain. If it's not treated for, you can get very, very sick. And so you do want to get it treated. There are different types of prostatitis. There are acute prostatitis, which is the more dangerous one. Chronic prostatitis is less dangerous. And I think it just depends on what exactly your specific situation is. But if you are in that acute phase of prostatitis and you're having high fevers, pain, make sure you go to an emergency room. Don't wait. It's not going to get better on its own. Okay. If you're having pain in your testicles, please see a urologist or your primary care doctor to evaluate. Testicular pain is very challenging. Sometimes we can find a cause for it and sometimes not. Very often it's also multifactorial. It can be due to pelvic floor dysfunction. It can be due to changes in your nerves that go to the scrotum. And there's lots of different things that can cause it. And it can be very challenging, but it is something that can be very debilitating to your quality of life. So I do encourage you to see. There's a number of different specialties that can help with this. Certainly pelvic floor physical therapy can help. A specialist in pelvic medicine and rehabilitation can help, as well as a urologist, and even a pain specialist or a pain doctor can help with those things. Okay, so anal fissure surgery is not performed by a urologist, so you need to see a colorectal surgeon. If you want an appointment with me, you can log on to my website, renamalikmd.com, and schedule an appointment, fill out the form there. I can only see virtual visits for people in Maryland, New York, and Texas, because those are the states that I have a medical license in. Otherwise, you will have to travel to see me. I have an office in Baltimore, Maryland, and Columbia, Maryland. Vein swelling on a flaccid penis, there's nothing wrong with that and nothing to do about it. To what extent can pornography cause erectile dysfunction? Well, pornography, when used, in moderation, is probably fine. If you're starting to have unrealistic expectations of what your particular performance could be or what sex is going to be like, that can affect you psychologically, which can affect your ability to have erections. So you kind of need to look at your own thought process and see if that's affecting you at all. Is oral sex okay? Yeah, it's totally fine. Yes, Kegels can help in delaying premature ejaculation. Absolutely. Is there a natural way to increase girth? So no, unfortunately, there is nothing that has been proven as a natural way to increase penile girth, but weight loss is a great way to increase your length. So if you lose weight, you will lose weight at the mons, which is the area right above the penis, and it will make your penis appear longer. It will not actually be longer, but it will look longer to you and your partner. What happens if you pee more at night than during the day? So I see this a lot in patients, and waking up at night to urinate has a number of different reasons. Again, these things have a lot of problems that can cause it. One is sometimes people are drinking a lot before bedtime, particularly right up until the time they go to sleep, which will definitely make you wake up. So I tell people who are waking up a lot at night to avoid drinking anything 2 hours before bedtime. Also, certain medications like diuretics or water pills can make you make more urine than you're actually drinking. And that can make you wake up more depending on the timing of your diuretic. So in fact, the best time is usually the early afternoon, like noonish, because then by that time you'll get rid of all your excess fluid before bedtime. Whereas if you do it too early, you could have, again, fluid build up later in the day. And if you do it too late, then you'll be waking up to urinate at night. Also, if you have obstructive sleep apnea, which is often is a problem where you'll find yourself maybe gasping for air in the middle of the night, you may not notice, but your partner or someone you sleep with will notice. Very often you can tell if you have a very wide circumference of your neck. That can make you actually has been correlated with waking up more at night to urinate. So getting that treated with a sleep doctor can be extremely helpful. Other things are overactive bladder that can cause waking up at night, or having a large prostate, which can cause it to be more common to wake up at night. And certainly certain neurologic conditions like Parkinson's or multiple sclerosis or things like that can also make it more likely that you'll wake up at night to urinate. And these are very complex things that need, further evaluation with a urologist and whatever doctor, if it's a sleep specialist or neurologist. All right. So I'm going to do about 5 more minutes of questions, and I appreciate you guys all joining me. So thank you so, so much. Does having finasteride cause shrinking of the penis? Well, so finasteride is a medication that is often used for enlarged prostate, to use to shrink the prostate. It does have some pretty significant sexual side effects. It can cause a decrease in libido, and that, because of that, can also cause less erections. And when you have less erections, it can appear that your penis is not getting as much blood flow, and then you can seem like you're having some shrinking. But yes, finasteride can cause some pretty significant sexual side effects in a large portion of patients who take it. So please, if you're taking it, be careful. And if you're finding these symptoms happening, talk to whoever prescribed the finasteride and say, maybe you want to get off that. So someone asked about jelqing. I made a whole video on jelqing. Jelqing is the process by which people try to extend their length and girth by actually kind of doing exercise and pulling on the penis. This is actually very dangerous. It can cause loss of sensation, erectile dysfunction, micro tears, things like that in the penis. If and we've seen lots, as urologists as a community, see a lot of people who have some pretty bad side effects due to jelqing. So I would not do it. I think it's unsafe, and so I don't recommend it. Should you use sildenafil during first-time sex? No, sildenafil is also commonly known as Viagra. It's a medication used for erectile dysfunction. I would only recommend using it if you have erectile dysfunction. If you are having difficulty obtaining an erection that is sufficient or like hard enough to have intercourse. If you are able to have a sufficient erection, do not use it. The risk being, one, there are certainly side effects with the medication. Very commonly, men will complain of like a head cold feeling or stuffy sinuses. But above and beyond that, sometimes men will complain of some blue-green vision discoloration. And the biggest fear is having an erection that lasts longer than 4 hours. And I know there's lots of jokes like, oh, that sounds great, but really it's actually quite dangerous. If you have an erection that lasts for longer than 4 hours, that can then create an environment in your penis where you are no longer getting good blood flow to the penis. And this then creates a problem where you need to go to the emergency room and we need to evacuate the blood from the penis. And that is, quite an involved procedure and not a fun one to go through. So please don't mess with those medications unless you absolutely need to. And I advise you do it under the care of a physician to make sure that it is safe for you to take it. There are certain medications or medical conditions that make it where you can't take the regular dose, or you shouldn't take it at all. All right. So I have a question about someone who's been trying to conceive and have a baby, and they haven't been successful after 2 years. So at this point, it's absolutely necessary for men to go get a semen analysis and a blood work panel to see if they have any problems with their semen parameters, the number of semen, the way they move, and there's a number of different factors that go into the analysis. And then women should also see a obstetrician to undergo an evaluation as well to see what are the factors contributing to that difficulty conceiving. And you can see that actually in about half of fertility cases, it will be both the man and woman who have a problem that's contributing to the fertility. And then about another 20% where it's the man and another 30% where it's just the woman. Is a circumcision reversible? Unfortunately, no, it's not. Okay. Are there any daily supplements for penile health? So no, there are. I mean, there's certainly a lot of supplements on the market. Whether they do what they claim is unclear. Very few supplements do the actual rigorous clinical testing, which is where they take somebody who takes a sugar pill or a placebo and then takes their supplement and measures if they actually do what they claim. Typically, what they do is they find all these ingredients that have shown some benefit and they put them together and they say, well, look, we have these, this data from other studies that says these ingredients will help. But we don't know where they're sourcing their ingredients from or any of those things. I found this website recently, examine.com, which actually does a nice job of going over some of the evidence on these supplements. And there's also, I'll have to look it up. I'll look it up. There's another thing that you can look for on your supplements to see if they go through kind of some regulatory findings. And so I don't recommend taking any supplements at this time. I would say if you can eat right, eat healthy, get some exercise, do things that are healthy for your heart, that will be healthy for your penis as well. So making sure you get, physical activity at least 3 to 4 times a week of at least 30 minutes or longer. You're eating lots of fruits and vegetables, avoiding processed sugars and carbohydrates. All those things are going to be good for you overall. Okay, guys, thank you so much for joining me today. I appreciate you all so very, very much. And always remember to take care of yourself because you're worth it. And thank you again.